the circumstances that led to your group or you first becoming conscious of the terrible new disease, AIDS?
I can tell you the moment. We had a lot to do with the pathologists as well as our own department there of medical microbiology. And one day, one of the senior pathologists came to me and said, "You heard this new disease, and I think this was the end of '82. This new disease that you have over in North America." He said, "I think I've just seen one." And it was a lady who'd died, and he had, and I remember going in with him to see the slides, and she was full of a bug called pneumocystis, which was what killed an awful lot of people early on in the AIDS epidemic everywhere. And so this was probably, this was sometime in '82. So we started looking for it in our sex workers. There was no way of making a diagnosis then. It was really January '84 that the first serologic test was available. But we started seeing the odd sex worker dying of usually tuberculosis and not responding to treatment well, and we were wondering, is this AIDS? But we had no way of knowing until we got permission, and we didn't get permission to study it because the government didn't want to believe they had this disease. They knew it was in Uganda, but they kept saying it wasn't in Kenya.
It was also, am I right that it was also at first thought to be exclusively a disease of homosexuality?
Yeah, men having sex with men. I mean, we knew that hemophiliacs had it from early days. From late '81, we knew hemophiliacs were getting it. Men who have sex with men were getting it. And there was the story from Port-au-Prince in Haiti, where they getting it, and the hemophiliacs were getting it. So it was called the 4-H disease for a year or so. Anyway, no, we were very fortunate that we got permission in late '84 from a friendly minister of health to start looking for it, and so we began a study, and initially the results were done at NIH because we didn't have the work to do it, and we were amazed that we thought maybe 1 in 50 of our sex workers. By this time we had, I think 900 enrolled as part of our cohort of sex workers, and by then we were at 30-some% were infected with HIV, and we got those results back and published in '86, and that was really the first. Well, Uganda had it a year and a half earlier from the work of the Ugandans, but and as soon as we recognized what was happening, we started trying to get permission from the government and from funders in Canada that this should be our focus.
And